Welcome to the deep dive. Today we're digging into a really complex situation involving state spending, crisis management, and the Alabama Department of Corrections.
That's right. We're looking at this unprecedented plan, billions of dollars aimed at overhauling a prison system facing huge challenges.
Huge is maybe an understatement. The U.S. Department of Justice actually declared the conditions unconstitutional.
Exactly. It wasn't just a slap on the wrist. The DOJ filed a lawsuit, and the details are pretty stark: widespread violence, sexual abuse, staff using excessive force across 13 men's prisons.
Basically, a failure to provide even basic safety for the people incarcerated.
That's the core of it. And the state's response, well, the price tag is just enormous.
Yeah, I saw the figures. We're talking projections of ADOC spending hitting $5 billion over just 5 years. That's FY 2022 to 2026.
$5 billion. And let's be really clear for you listening, that's the operational cost. That's just running the system they already have.
The system that the DOJ says is broken.
Right. And that huge number, it eats up 25%, a quarter, of Alabama's entire general fund budget.
Wow, a quarter of the budget.
And crucially, that doesn't even count the new money, the billions borrowed for the construction we're going to talk about.
Okay, so let's unpack the rationale here. Why this massive investment? The state had to justify it somehow.
Well, the starting point was the physical state of the prisons. The ADOC commissioner himself, Jefferson Dunn, admitted the facilities had crumbling infrastructure. He said they were literally falling apart.
Crumbling infrastructure. That sounds pretty bad.
It was. They needed something like $440 million just in deferred maintenance to meet minimum safety standards. We're talking basic stuff.
And the human cost of that decay. The sources mention things like no air conditioning. Wasn't there a case where someone died from heat?
Yes, hyperthermia in a cell over 100 degrees. And that wasn't isolated. You had showers thick with mold, often no hot water, sewage systems failing, just awful conditions.
That kind of environment, I mean, it's bound to lead to problems beyond just discomfort.
Absolutely. It breeds violence, despair,
Yeah.
death. 2023 saw the highest number of deaths ever recorded in the system, 335 people.
335.
Yeah, including 14 homicides, over 100 drug overdoses. Even when the number dipped slightly the next year, Alabama still has one of the highest prison death rates in the country. That's the human toll of this failure.
So, okay, the buildings are falling apart, but fixing buildings alone doesn't solve everything, right? There were other major issues.
Exactly. Two huge ones: overcrowding and staffing, or maybe lack of staffing.
Right. The overcrowding numbers were pretty wild. The men's prisons were designed for, what, around 9,500 people?
Designed for 9,462, yeah. But they were actually holding about 14,250 men. That's serious system-wide overcrowding.
And some places were much worse. I remember seeing Staten Correctional Facility was at 265% capacity.
265%. Just imagine trying to manage that. How can staff possibly maintain order, let alone offer any kind of rehabilitation programs?
Especially when there aren't enough staff to begin with. That was the other crisis point.
A massive staffing crisis. In early 2021, ADOC had barely filled half its authorized correctional officer jobs. About 1,365 filled spots out of over 3,100 needed.
Half. So 8 entire prisons had vacancy rates over 50%.
Yeah, places like Bullock at 60%, Donaldson at 58%. You simply cannot run a safe facility like that. It directly connects back to the DOJ finding the state couldn't protect people.
Okay, so terrible conditions, dangerous overcrowding, chronic understaffing. The state responds with this Alabama Prison Transformation Initiative, APTI.
Right. The big idea was consolidation. Close down, I think, 14 older prisons and build 4 massive new regional centers.
3 for men, 1 for women.
Exactly. 3 4,000-bed men's facilities and 1 1,200-bed women's facility. State-owned this time.
And the stated goals were, what, reduce overcrowding down to maybe 125%?
That was the target, yes, over 5 years. And also, critically, create spaces where they could actually deliver programs: substance abuse treatment, education, job training, things that were impossible in the old, chaotic facilities.
And they claimed it would pay for itself somehow.
That was the pitch. The operational savings from the new, efficient facilities were supposed to cover the debt payments on the construction bonds. Fiscally neutral, they hoped.
Which brings us neatly to the cost shock. Let's look at that signature project, the Governor K. Ivey Correctional Complex. 4,000 beds in Elmore County.
Yeah, this one project really tells the story of the spending. The initial estimate was around $623 million.
Okay, still a lot, but...
But the actual construction cost shot up to $1.08 billion. And the total project cost, including everything else, hit $1.25 billion.
$1.5 billion. for one prison complex.
It's been called the most expensive prison ever built in the United States.
And that cost per bed figure is the one that really jumps out. It's about $300,000 per bed.
Roughly, yeah, $300,000.
Which you pointed out is significantly more than the average price of a house in Alabama.
Right. The average home price around July 2025 was cited as $235,066. So yeah, substantially more to house one inmate than the cost of an average family home. It raises questions about efficiency, doesn't it?
It certainly does. How did proponents justify that kind of expense?
Well, the argument is that these aren't just cell blocks. They had to build basically entire service centers inside the walls. Massive facilities for mental health care, advanced medical treatment, complex vocational training labs, welding, HVAC, you name it.
So, building hospitals and trade schools inside a prison.
Essentially, yes. Built from the ground up to meet modern standards and, frankly, to address the failures the DOJ pointed out, that infrastructure costs a lot.
Okay, that adds context. But the way they funded it also stirred up controversy, didn't it? Using COVID stimulus money.
That was a big one. They authorized $1.3 billion in bonds, but $400 million of the funding came from Federal American Rescue Plan Act, funds the COVID relief money.
And critics jumped on that, asking why pandemic recovery funds were going to build prisons.
Exactly. It became a major political fight. And remember, this construction cost is on top of other spending related to the failing system.
Like the legal bills?
Huge legal bills. At least $57 million paid out from the state's liability fund just for ADOC's legal expenses.
$57 million defending officers accused of misconduct or fighting these big federal lawsuits.
Wow. Defending the very system they were simultaneously arguing needed replacing.
So when you step back and look at the whole state budget, where does ADOC fit in? We said 25% of the general fund earlier. How does that compare?
It's striking. Compare it to Medicaid. Medicaid provides health care for about 1 million Alabamians, right? It's the state's single biggest expense.
Okay.
That massive program serving 1 million people costs the state roughly the same amount from the general fund as incarcerating about 22,000 people through ADOC.
1 million versus 22,000. That's quite a comparison.
And look at prevention. If you combine the budgets for agencies like the Department of Human Resources, Mental Health, Public Health, the ones focused on community well-being,
Yeah.
all those combined get only 19% of the general fund, less than ADOC alone.
And you mentioned that the trend is going the wrong way for prevention funding.
Definitely. DHR, which handles vital community services, used to get over 7% of the general fund back in 2003. Now it's down to 4.5%.
So structurally, the state is choosing to invest vastly more in incarceration, in building prisons, than in community support and prevention.
That's what the numbers show, which really makes you question that initial promise about the new prisons saving money.
Right, the illusion of savings, as you put it. Let's get into that. They claimed these new efficient facilities would fund themselves.
They did. They projected big savings like $21 million a year just from cutting overtime for officers by 65–70%. Another $17 million from needing fewer staff overall due to consolidation.
And those savings were crucial because they needed about $50 million a year just to pay the debt service on the construction bonds.
Exactly. The math relied on those savings materializing.
But critics are skeptical, right? Can new buildings really fix these deep-seated problems?
That's the core critique.
Yeah.
You still have violence.
Yeah.
You still have drugs getting in air. Remember, contraband flowed freely even when COVID shut down visitation.
So if the operational controls, the staffing issues aren't fundamentally fixed, will just having newer buildings actually lead to safety and stability?
Or could consolidating staff, aiming for those savings, actually make the vacancy crisis worse in some ways? That's the concern.
It feeds into that broader argument that this is just an expensive Band-Aid. Haven't we seen this before?
We have. Previous governors responded to earlier DOJ lawsuits by building new prisons. And those prisons are the ones that are overcrowded and falling apart now.
So building more capacity doesn't necessarily fix the underlying reasons why so many people are incarcerated in the first place.
Precisely. Which brings up an interesting twist in this story. The initial plan wasn't even for state-owned prisons.
Oh, right. Governor Ivey originally wanted private companies to build and lease the facilities, CoreCivic and others.
Yes, that was Plan A, Lease 3, privately built mega prisons.
But that didn't happen. What stopped it?
Activism. A really effective coalition called Communities Not Prisons. It was diverse, multiracial, urban, rural folks working together.
And what did they do? Protest at the State House.
They did some of that, but their key strategy was targeting the money. They went after the banks that were lined up to finance the private deal. Barclays, KeyBank, Stiefel.
Ah, follow the money. Smart.
Very smart. They hammered Barclays, for instance, pointing out the bank had publicly pledged not to finance private prisons anymore. They highlighted the hypocrisy.
And that public pressure on the banks actually worked.
It did. Barclays pulled out, then KeyBank followed. Without the main financiers, the whole private lease plan just collapsed.
Wow. So that grassroots pressure fundamentally changed the state's direction.
Absolutely.
Yeah.
It forced the state away from privatization and towards this current path, direct public ownership, leading to this incredibly expensive state-built mega prison.
It's quite a story of how activism can reshape state policy.
It really is.
And just quickly, on the construction itself, they chose a specific method, design build.
Right. Design build DB instead of the more traditional design bid build, DBB.
DBB is usually seen as more transparent, isn't it? Given the cost blowouts, was choosing DB a factor?
Well, DBB might seem more transparent on the surface, but ADOC's analysis argued DB would be significantly faster, maybe 33% faster.
Speed was the priority.
It seems so. They also argued DB could deliver lower unit costs and higher quality, despite the transparency concerns. Facing the DOJ pressure, getting it built quickly was likely a major driver for choosing design build.
Okay, so wrapping this all up for you, the listener, what we're seeing is this absolutely massive investment, $1.25 billion for just one complex.
An investment designed to fix these incredibly deep problems. Violence, overcrowding, staff shortages, unconstitutional conditions.
And the central tension remains. Is this unprecedented spending truly solving the core issues? Or is it just replacing old broken walls with new, very expensive ones, while the underlying funding priorities and systemic drivers remain untouched?
And you have to recognize what this new mega prison represents. It's not just housing. It's designed as the state's main hub for mental health care, serious medical treatment, and all those vocational programs.
So the correctional system itself has become the state's primary provider of these essential social services at enormous cost.
That's the reality. It highlights a profound dependency.
So as you think about this, consider the promise. Maybe the new buildings, maybe improved staffing models will finally fix the safety crisis that sparked the DOJ lawsuit. But here's a final thought to chew on.
The state justified all this spending, partly by claiming operational savings would cover the debt and new programs would cut recidivism. But even if the new prisons work perfectly as designed,
what's the next step? What's the plan to address the things that drive incarceration in the first place, like low parole rates or that huge shift in funding away from community agencies like DHR and mental health? How do you make these changes last for the next 30 years?
without tackling those structural funding choices, those systemic drivers, are you just setting up the next crisis down the road?
Something to keep thinking about. We'll see you next time on The Deep Dive.